Hi everyone, my name is Tree, and today I will be presenting about malaria. To start off, the etymology of the name malaria comes from the Latin words mal and air, which translates to bad air, and this is descriptive of some of the symptoms that a patient with malaria would experience, such as a lack of oxygen in the blood and an increased respiratory rate, which I'll talk about later. And malaria has been around for quite a few millennia, with um, evidence dating back to ancient Egypt, where some malaria antigens were identified in ancient Egyptian remains dating from roughly 3200 BC to 1304 BC. And malaria-like symptoms have also been recorded in ancient civilizations such as Mesopotamians as well. And in the US, malaria used to be a problem in the 19th century and the 20th century as well. So to sort of contain and prevent the disease, the Centers for Disease Control and Prevention, the CDC, was founded. Nowadays, malaria is still a major problem in many parts of the world, such as Asia, the Middle East, Central America, and parts of South America. But the place where we see this as the greatest problem is in Africa, where 80 to 90% of the malaria cases and deaths occur. And in the 18th century, malaria was such a great problem in West and Central Africa that as European colonists and explorers came to Africa, so many of them died that it earned the nickname of the white man's grave. So malaria is caused by a parasite, making it coming from the domain Eukarya, and it is caused by parasites from the genus Plasmodium. And there are 5 specific species that we will discuss today that cause malaria in humans. So there are 5 different species of Plasmodium that are known to cause malaria in humans, and they're Plasmodium falciparum, Plasmodium vivax, Plasmodium ovale, Plasmodium malariae, and Plasmodium knowlesi. And I've included the images on the right hand side, and these images are of the Plasmodium parasite in red blood cells. So you can see the parasite in sort of the bluish in each image, and the purple is the red blood cells. So Plasmodium falciparum is the most harmful of the 5 species of Plasmodium, but it's not the most widespread. And the most widespread is Plasmodium vivax. And part of the reason why it's so widespread is because it's able to have a dormant liver stage, which means that it will lie dormant in the liver and can relapse a couple months, maybe even years after the initial mosquito bite that spreads the parasite. In addition, it is so widespread because it is able to survive colder temperatures, so it can survive different geographical places in the earth, such as tropic, subtropic, and temperate climates. And Plasmodium ovale is pretty similar in many of its properties to Plasmodium vivax. And the first 4 Plasmodium species that I've listed are all strict human pathogens, but the last one, Plasmodium knowlesi, was recently determined to also be a pathogen for humans, but initially is natural for macaques, but it has been determined to be a zoonotic pathogen for malaria to humans. So the Plasmodium parasite that causes malaria is spread primarily through an animal vector, more specifically the female mosquitoes of the genus Anopheles. And the reason why it's only female mosquitoes is because female mosquitoes require the blood from humans to produce their eggs. And in the genus Anopheles, there are 50 known species that are determined to be animal vectors for the Plasmodium parasite. And in Africa, 2 of the most common species are Anopheles gambiae and Anopheles funestus. And after a mosquito bites someone, the parasite would enter the bloodstream, and from there it would infect the liver cells, and after a certain period of time it would infect the red blood cells. And in rare cases of transmission, the parasite can spread through blood transfusions, through organ transplants, contaminated needles or syringes, or congenitally, so from a mother to an unborn infant. So to show how prevalent malaria is around the world, here's a map of the places where it occurs most often. So in the yellow are places where it occurs but not to a great extent. So we can see that in Central America and parts of South America, in China, the Middle East, and very few parts of Africa. But the places where it occurs the most are in sub-Saharan Africa, so Central and West Africa. And the reason why it occurs in these places more often is because the parasite requires these certain temperatures to survive and thrive and reproduce within the mosquitoes. So some statistics: in 2020, roughly 241 million cases were recorded of malaria, and this resulted in roughly 627,000 deaths worldwide. And the reason why malaria is such a great problem around the world is because nearly half of the world's population lives in areas where malaria is prevalent. So that encompasses roughly 87 countries. So this puts the populations in these areas at great risk of the disease. So to properly understand how the Plasmodium parasite causes disease within the human body, it is important to understand the life cycle of the parasite. So first, we'll start with a mosquito injecting someone, and as a mosquito injects someone, it will inject the parasite as a sporozoite into the human body. The sporozoites will travel to the liver, where it will infect the liver cells and form schizoids. And these schizoids allow for asexual reproduction to take place, and therefore the parasite can start reproducing within the human body. And it's important to note that two certain species of the Plasmodium parasite, specifically Plasmodium vivax and Plasmodium ovale, can undergo a dormant phase where they become hypnozoites, where they can remain dormant in the liver and relapse after a certain period of time, such as a few months or maybe even a few years. And eventually these schizoids will rupture the liver cells and release merozoites, which are essentially daughter parasites. And these daughter parasites will go and invade red blood cells, where they can form more schizoids and produce more parasites, or they can become gametocytes and eventually be taken up by another mosquito, where the whole parasite life cycle restarts again. And of importance is the erythrocytic cycle, or the part of the parasite life cycle where the parasite has infected the red blood cells. Is at this stage where many of the symptoms that a person with malaria would usually experience come from. So like I mentioned earlier, many of the symptoms caused by the disease come from the events that occur in the erythrocytic stage, so the stage where the parasites have infected the red blood cells. And the incubation period is roughly 7 to 30 days. And what causes many of these symptoms is the rupture of the erythrocytes. So that as the parasites infect the red blood cells, the amount of parasites will eventually cause the erythrocytes to lyse and release numerous waste products as well. So because these erythrocytes will be ruptured, there will be a low red blood cell count as a result, and this can lead to anemia. So we'll see a lot of symptoms of poor oxygen content within the blood, which can affect the brain and other organs as well. And it can also cause jaundice because the liver will produce bilirubin, which will cause a yellowing of the skin and of the eyes. So some of the waste products that are released are toxic, such as GPI or hemazoin, and as a result of these waste products, the immune response will release cytokines and oxygen intermediates, to name a few, that will cause some of the symptoms, such as like a fever or sweats. Additionally, some of the infected red blood cells will stick to the blood vessels, and this can be very fatal if it occurs in the cerebrum, because the brain will not be able to receive red blood cells and oxygen as a result, and will lose function. And something to note is that it has been noted that people who have sickle cell anemia or are sickle cell anemia carriers have some sort of protection against malaria, because the does not allow for the parasite to fully develop within the erythrocytes. So there are two types of malaria that must be distinguished. First is uncomplicated malaria, where we will see more mild symptoms of the disease, but there is also severe malaria, which in many cases will cause death. So in uncomplicated malaria, we will see symptoms such as fever, chills, sweats, headaches, nausea and vomiting, and body aches, most of which are caused from the immune response to the waste products that are released from the parasite. But in severe malaria, we will see symptoms such as cerebral malaria, where because of the buildup of red blood cells in the cerebrum, the blood vessels in the cerebrum, seizures and comas can occur. We can also see severe anemia or severe hemoglobinuria, which is where hemoglobin will can be present inside the urine. And severe malaria can also cause acute respiratory distress syndrome, which will affect the lungs, and also low blood pressure. And some telltale signs of malaria are an enlarged spleen, mild jaundice, like I mentioned earlier, because of the bilirubin that the liver produces, and enlargement of the liver because the parasite will also infect the liver cells, and also an increased respiratory rate. So the way in which malaria can be diagnosed is through a blood smear microscopy, where a blood sample is taken from the patient and the red blood cells are examined under a microscope to see the presence of the parasite. Another method is rapid diagnostic testing, or RDTs, and this allows for a rapid diagnosis of the disease. In addition, PCR testing can be done. PCR testing is a good alternative, but it does take a long time compared to RDTs, but is able to determine the species of malaria that is present, which can be very helpful for determining the treatment for the patient. So how do we prevent and treat malaria, which is a disease that poses a threat to 50% of the world's population? So unfortunately, there is no vaccine available to prevent the disease, but the best option is to avoid traveling to these areas where malaria is prevalent. So it will be these warmer climates such as those in Central and South America, Africa, the Middle East, or Asia. But for people living in these areas, the best option is to prevent getting mosquito bites. So this can either be through using insect repellent, through wearing clothing that covers the skin, through placing wire meshes on the doors and windows of one's home to avoid having mosquitoes come in, or to throw out standing water frequently to avoid having these mosquitoes lay their eggs and reproducing. And to treat the disease, drugs have been designed to kill these parasites, but unfortunately there have been many occurrences of the parasites building resistance to certain drugs, which makes it very difficult to treat malaria. Thus, when a doctor has to prescribe a medicine for a patient with malaria, they have to know what species of parasite has infected the person. So chemoprophylaxis is the method through which the medicine will kill the parasite before it ruptures the red blood cells and really causes the symptoms that cause the disease. And for example, chloroquine is the drug that is used in Central America and the Middle East because the strains or the species of parasite that are prevalent there are not resistant to chloroquine. But in Thailand, the species there is resistant to chloroquine. So doxycycline is used as an alternative. Thank you for watching my presentation.